Welcome to today's show. I'm here with Doug Carey today. Doug, good to have you with us.
Good to be here.
So, Doug, aside from being an attorney, can you give our listeners some of your background about how you got to where you are today, your journey through life, and then we'll go into what your current practice is like.
All right. I grew up in Menlo Park, California, just across the bay from you. Went to law school at the University of California, Hastings in San Francisco after doing my undergraduate at BYU. I worked my way through law school as a police officer in the city of Menlo Park. So that was an interesting experience. There are times I look back and say, maybe if I'd taken that job they offered me, and I wouldn't be in this mess, but I didn't. And so I graduated from law school in 1977, quite a few years ago, and went to Virginia to begin my practice, which is where my wife was from. We met at BYU. The farmer's daughter from Virginia and the lawyer's son from California. Where else would they meet? And we went back there for about 4 years, where I opened a practice and then went into a firm. My father became ill. He was a sole practitioner in Redwood City, California. And I then decided I'd come out and help him while he was in the hospital. And he made me an offer, and we moved back to California. That's when we moved to Fremont and lived there for about 13, 14 years. Our youngest daughter was born in Fremont, and the other two Bill graduated from high school, from American High School. Jennifer was a freshman, and Sarah was in probably 5th grade when I decided, well, I'd been talking to Jennifer, and she was saying it was harder to say no, and the temptations were getting great. So we decided we'd try back in Virginia, and we moved to Suffolk, Virginia, which is in the Tidewater area near Virginia Beach and Chesapeake, Norfolk. And I went to work for legal aid, which was an interesting 5 years. I worked for 2 different legal aids and got to see how the other side lived, and enjoyed that very much. Then Sarah, who was a sophomore in high school by this time, decided she and her best friend wanted to pursue a singing career. And then at that point, in the late 1990s, Orlando, Florida was a hotbed of pop music. And so they went down there. My wife took them down. They rented an apartment. She went down as chaperone because we were going to let 2 15-year-old girls go to Orlando by themselves. And I stayed in Virginia, continued my practice with legal aid, figuring it maybe last 6 months and they'd be back. Well, it turns out it didn't. They formed a girl group that started touring, free gigs, no big money involved. So I went down there and joined them, and worked for a corporation as a lawyer down there, because I didn't have to take the Florida bar. I could do it with my Virginia bar. The group stayed together 3.5 years or so, and they finally broke up, as most of them do. Sarah is the only one still in the industry of the 4 girls that were involved in the group. She's still acting. She's done some Disney and some things out in California now. I decided once they graduated from high school, Jennifer, my middle daughter, graduated from college, moved out to Southern California to UCLA. The humidity in Florida was getting too much, and we decided we'd move. We weren't quite sure where, but my son and his wife were living in Henderson, Nevada. They were having a baby, and my wife went out for that, and we ended up moving to Henderson, Nevada. I became a security guard at a casino with my law enforcement background for 3 years. And then I got into what I'm doing now, which is Medicare insurance. I left the practice of law back in Florida. I have 30 years was enough, and I sort of burned out on that, and then came out here.
It's interesting that the timing to go into Medicare is actually a fairly hot area right now with all the aging baby boomers, for which you and I.
Oh yeah, I basically got into it. How can I make money as a consultant advising people on Social Security and Medicare?
Mm-hmm.
And problem is, a lot of people in that age group either have enough money, they already have a financial advisor, or they can't afford a financial advisor.
Mm-hmm.
And so I met Travis and Calvin, who were just starting up an agency. They'd been doing, two of them, they were brothers-in-law actually, they're married to sisters, had been doing Medicare insurance for about 4 years, done very well at it, and decided they were going to try to form an agency. So I was one of the original 6 in that agency. That I was the last one on board, and so it's gone from there. They're now up to about 90 agents, both in-house and, like I am, an independent agent. So that it's grown over the last 7 years.
So let's roll into what are some of the common areas of Medicare that are often not understood by people in that category.
Most of it.
Okay.
Well, many people, they hear this talk about Medicare for all,
Mm-hmm.
and they figure everything's free and everything comes along and you're taken care of and everything. That's not how Medicare works. Okay. When you turn 65, you're eligible for Medicare, assuming you've worked the requisite number of quarters, which is 40, or your spouse has. You're eligible for Medicare Part A, which is hospitalization at no cost.
Okay.
That costs you no monthly premium, but there is a co-insurance when you go into the hospital. This year it's going to be slightly over $1,500. And that's each time you go into the hospital, not an annual deductible. That's each time for a different condition you go into the hospital. Then there's Medicare Part B, which is doctors, labs, medical insurance. There's an annual premium on that, which next year is going up to $152 a month. 90% of the people get it taken out of their Social Security check. The other percentage are on Medicaid, and therefore Medicaid pays that. But you pay there's an annual deductible of $205. Then you're responsible for 20% of that with no cap. If you get really sick, there is no max amount of pocket available under Medicare. Then there's Medicare Part D, which is probably the least understood, although it seems the simplest. It's a prescription drug plan. What many people don't realize is that if you don't get it when you're first eligible, and you don't have any other prescription drug coverage, like an employer plan or VA, there's a monthly penalty if you don't get it within 63 days of becoming eligible. It's 1% of the average monthly premium, which for this year was like 37 cents. But that's 37 cents a month at the lifetime penalty. So if you go 10 years without it, that's $40 a month for the rest of your life. And the premiums on those plans run around $15 to $25, and you tack the $40 on top of that, it can get expensive. And most people I've talked to are not aware that there's a penalty for not taking a Part D plan.
Mm-hmm. So Bill, when somebody comes to you and says, I need help, but I don't know where to start, and what exactly do you do? And there's often this thing that you'll hear about, dad's getting sick, and let's go see if we can get him on the Medi-Cal plan and throw all the assets into some type of trust and make him look like he's broke. I mean, does it work?
Under the right circumstances, it can work. I have not done that. That's not been something, it was never part of my law practice, and not something I have done, because by the time they get to me, it's too late. You can't do it once they're ill. You got to do it. You got to do some pre-planning. It's really tough for those who are lost their insurance, like right now in the pandemic. All the people we fortunately here, a lot of the casinos, while they're not putting people to work or they're working minimal hours, have kept up their insurance. But that's going to end either December 31st or January 31st of next year. I've got a number of clients that came to me this year, fortunately, and they're 65, but they're working at the casino, so they never did worry about Medicare. And now they're losing their insurance, even though they may be still working at the casino. And I've been able to enroll them in a Medicare Advantage plan or a Medicare Supplement, whichever they want. Most of the time here, it's a Medicare Advantage plan. But those who are under 65 are really in a world of hurt, because we just finished up open enrollment under the Affordable Care Act, or Obamacare. And that, you get to be 60 years old, late 50s, early 60s, it's expensive. And there are high deductibles. To get it down anywhere near reasonable price, you got to pay $8,000 or $10,000 a year deductible before it even kicks in. And that's really tough. And I really don't have a solution for those people.
When a person turns 65 and they're on the Medicare plan, essentially, do they also oftentimes require supplemental insurance? I mean, what's covered versus what's not under Medicare?
Okay. Again, hospitalization has the $1,500 deductible when you go into the hospital. After that, everything's covered. If you happen to go in for another condition later on in the year, it's not. You have to pay that $1,500 again. Mm-hmm. If you go to the doctor, you got the deductible, the $205 next year, and then 20%. It just keeps adding up. So many people there are two paths you can go. You can go to a Medicare Supplement or a Medicare Advantage plan. Medicare Supplement allows you to go to any doctor, any facility in the United States which takes Medicare. And they will accept that as payment. They take the Medicare, that they bill the supplement, and whatever the supplement covers, that is taken care of. Right now, since the January 1st of this year, people turning 65 are not eligible for a Plan F, which covered everything. No deductibles, no copays, nothing. Their best plan for most of the people left for now that turned 65 in 2020 is a Plan G. Plan G, you pay your annual deductible to your Medicare Part B, $205, and then the 20% is covered. So that's it. Your costs are fixed. You know your monthly premium, and you know your annual deductible, and you don't pay anything else above that. Unless you travel outside the country, and that's a whole other issue at times. But as long as you're within the United States and you go to a doctor that takes Medicare, you're covered.
Does your legal background give you a competitive advantage as an insurance agent?
Sometimes. It gives me a broader range in background so that I can understand why they're doing some of the things they're doing, and what I may not like it, but I understand it, and so that's where the legal background has helped, and then it gives me a broader base of conversation with people, and that's what a lot of it is, talking to people.
How do people find you, Doug?
Word of mouth. We just spent an open annual enrollment. Got to get those two terms straight. Annual enrollment is October 15th to December 7th. The open enrollment is January 1st to March 31st. So that's coming up. But annual enrollment is a big push. That's when everybody can review the plan they have, make any changes. They want to change plans, upgrade their plan within the carrier, go to a different carrier. And so we've done it. Last year I did it at CVS. Because I did it for Aetna at CVS because CVS bought Aetna, and we had manned a booth there. And this year we manned a booth at Smith's Food and Drugs, or I guess it's Rayleigh's in California. And that we just talked to people as they came into the store.
Now, educating, I noticed you do a lot of blogging or informational posts.
I do more on my website. I'm about to post a slideshow on the step-by-step how you apply for Medicare, what your requirements are, when do you do it, and what the different things are that go along with it, touching briefly on Medicare supplements and Medicare Advantage plans and Part D plans. But it's more of a how-to when you're getting up there and ready to apply. How do you do it, and what pitfalls to look for?
What is your website?
That should be up after the
So,
first
Doug, what
year.
is your website?
DougAndWhistleMedicare.com. My wife joined me this year. I don't know if you probably aren't aware, back when we were first married, going to school in San Francisco, she started out as a secretary for Great West Life Insurance Company of Canada. They're a group life and health, such as the Civic Light Opera, the Housing Authority, different agencies and places in San Francisco. She, after about 14, 15 months, she became an agent. She was the first female agent in the United States for Great West Life Insurance Company of Canada. And so she had a great background. This is, again, pre-ERISA, pre-Medicare, well, not pre-Medicare, but pre-ERISA and all those regulations that have since come in. But she had a great background, and she decided that was it. I'm not going to do that anymore. Raised our kids. Been a legal secretary most of the time since then when she's worked. And this year she decided to join me. And so she's great because, as you may recall, she can talk to anybody. Anybody will talk to her. She talks to them for 5 minutes, she gets their life story. And that's ideal in this business.
Yeah, Whistle is amazing from that direction. So
yeah.
Well, Doug, it's been a pleasure having you with us today. So why don't you give for the listeners your website once again?
Okay. Let me touch briefly, if I can, for about 2 minutes on Medicare Advantage plans.
Perfect.
Medicare Advantage plans, as opposed to supplements, they're all sold by insurance companies. Medicare supplements for a Plan G here in Nevada, the best rate is $140 a month. And they range from that to over $200 a month. So you shop it by price because the plans are identical. They cover exact same things. Medicare Advantage plans, on the other hand, are HMOs and PPOs. We're fortunate here in Southern Nevada, as they are in Southern Florida, in that whatever demographics and calculations they use, our companies get more money for the Medicare Advantage plans than they do most any other place in the country. So they're able to put extra advantage on extra benefits on them. All of our HMOs are zero premium. Two of the companies that have PPOs also have a zero premium PPO. And going to the doctor, going to the hospital, and all these things are zero copays. And so that they're very popular here because of that. They got people who don't like HMOs. The granddaddy of all HMOs is Kaiser there in California. We've got an organization fairly similar to that. They got everything that Kaiser has, but no hospitals. And that's United Healthcare. And they're the big elephant in the room because they probably have about 45% of the business. The other 7 companies divide up the rest of the area. But they are great plans if you can work. If your doctor takes it and you work into it, and they're all zero premium. So you pay your Medicare Part B premium, and that's it. So that's a Medicare Advantage plan as opposed to a supplement.
Are a lot of people taking the Advantage plans today?
Yes. I probably do 80% Advantage plans, 20% supplements. I don't know how typical that is. It may be a little high on the Advantage plan side because of the market I'm going after, but it's fairly typical for here because the plans are so good. We've got a client that moved to Mississippi, and all of a sudden she's paying to see the doctor. She's going to pay if she goes to the hospital. There's no transportation provided. Things like that are commonplace here. Really shocker for her when she moved that they weren't available.
Well, thank you, Doug. It's been a joy having you with us today. And give us the website one more time for the
www.dougandwhistlemedicare.com.
All right. Thanks for being with us today.